Hello, my name is Jill Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing healthcare, very important topics. So today I'm joined by Dr. Laura Bellstrom. She is a longtime community pediatrician who is now with Northwestern Pediatrics. And we're going to be talking today about a very important spring topic, and that is ticks. So, Dr. Bellstrom, thank you so much for being on this show. It really is an important topic. I think we kind of hate to talk about it, but it seems to be more prevalent. But before we get into that, remind folks how long you've been in the community as a pediatrician and a little bit about yourself.
Okay. Well, thank you, Jill, very much for having me for this episode of Health Beat. I'm really excited. I think it's a really timely topic. We think that spring is here, despite a couple of false starts, and ticks are definitely going to be on the horizon for us, and we're going to be hearing a lot about it in pediatrics. In terms of my background, as you said, I'm Dr. Laura Bellstrom, also known as Dr. Laura in the community, not to be confused with Dr. Laura Schlesinger of radio fame. And my background, I've been here in Vermont for the past 21 years, but my history in Vermont is even further back than that. I was raised in southern Vermont. I went away for college and then returned and came back and went to the University of Vermont for medical school.
Nice.
Had a wonderful 5 years there, did an extra year as a pathology fellow. And then was married. My husband and I moved down to North Carolina, where I pursued my residency at the University of North Carolina, and he was an educator and followed the Tar Heels with great glory. And then we our tenures are defined by the births of our two sons. We had our first son, and after he was born, despite some concerns on the infectious disease doc's part, we moved out to the Navajo reservation, and we spent his first 3 years of life working for the Indian Health Service.
Wow.
And we lived in Chinle, Arizona, which is kind of the Four Corners area of the Navajo Nation. And then our second child was born, and we moved back to Vermont to be closer to friends and family, and really sort of in the state that we love. Mm-hmm. And so for the past 21 years, have been practicing here in St. Albans. Started with Mousetrap, then I had my own practice for about 13 years, and with a lot of difficulty closed that practice. It was a little bit hard to maintain as a sole proprietor.
Right.
And then last year joined you with NMC Peds.
We're grateful.
and I'm grateful. I'm really sort of happy to be part of a now 8 pediatrician team. All of them are wonderful to work with. And so it's been a good fit. I'm working part-time and enjoying seeing a lot of my patients return and seeing new patients. So
nice. And you're on the campus at the hospital.
I'm here in St. Albans.
Yeah. Okay. Fantastic. So the topic of ticks. So is this something that with your patients that you're being asked a lot about? Are parents concerned about this topic?
It definitely starts to come to the forefront at this time of year. So this discussion is pretty timely. I actually, in the last month, have been on call several times and have fielded at least 2 calls already from parents who have removed ticks from their children. And it's only going to ramp up since the tick sort of number rises as we get into the summer months and even into the fall. So we're kind of leaving the respiratory season behind now.
Yes,
and we'll be entering into the summer season where we'll see a lot of summer illnesses and ailments, and ticks is one of the top of the list.
So the question I think folks ask a lot is the tick bite, is that harmful?
That is a great question, and tick bites in and of themselves are not harmful. There is always the possibility that because there's a break in the skin that there could be a more common just bacterial infection introduced, but I have to say in 25 years of practicing, I've never seen a localized staph or strep bacterial infection at the site. What we worry about really more is the transmission of tick-borne diseases. And there are a number of those, although in Vermont, the more common one, the one that we hear most about, is Lyme.
And we definitely want to talk about that. So if they notice a tick on the child, what should they do? Is there something they should do at home, or should they seek medical treatment right away? Or
that is another really good question, because we do get a lot of calls from parents who are justifiably concerned, and they want to bring their child in to have the tick removed by us. But I have to say, it is not a skill that you need to go to medical school for. It's pretty straightforward to remove a tick. And really, time is of the essence. So I would always recommend that parents try to remove the tick themselves. I did bring my handy little prop here.
What is that? Oh.
And so really all it takes to remove a tick is you want to get the fine forceps or fine tweezers right at the base of the tick, so that you have firmly grabbed on to the very where the tick is embedded into the skin. And you want to, with firm and steady pull upward, to pull the
So straight up, or
straight up.
or straight out if it's in the arm.
Straight up, straight out. Yep.
Okay.
And you want to avoid twisting, you want to avoid jerking, because in theory and ideally you'll get the whole tick out, not just the body of the tick, but you'll get the mouth parts out. Mm-hmm. But having said that, I have to say that even if the mouth parts are left in, it's okay. I've told many parents over the years that once you separate the head from the body, the tick is no longer alive, and they no longer can transmit disease. And over time, the mouth parts would work their way out. So in either case, it doesn't have to be removed in the office. We're always willing to do that. But really, you'd like to get the tick out sooner rather than later. So I would advise that parents take the tick out themselves.
And that's the key to it here, is to have some tweezers or these. Yep. And so there's no other little home remedy or anything that folks might try. This is something that we should all have available.
Yes, I would definitely recommend that. I smile only because I grew up during my childhood in Colorado, and I still to this day can remember my mother being fearful of ticks on us, and her suggesting that she was going to burn the tick out, to which my sister just immediately was in tears. And her method was heating up the tweezers and pulling it out that way. Some people talk about using a hot match to the butt of the tick, and that they'll bring themselves out, but I wouldn't recommend those methods. And other times people have talked about applying Vaseline or something to so-called suffocate the tick, but the tick has a really, really low respiratory rate, and it's not an effective way to remove it. So really the recommended way is with tweezers and kind of a direct traction upward.
That's very, very helpful. That's good.
Yeah. Yes.
I know, like on my dog and stuff, to pull those ticks out, and the dogs get them a lot too, and so that's helpful for all of us, I guess.
It can be very deeply embedded and hard.
Yes. Okay, so we've talked about the tick. So what is Lyme disease? And maybe tell us the story about Lyme disease.
So yes, Lyme disease actually was first kind of recognized in the 1970s, and it's called Lyme disease because there was a cluster of individuals who were found to have similar symptoms living in the old Lyme, Connecticut area. Okay. And so early in the disease, or the recognition of the disease, a lot of it was centered in Connecticut in the southern tier of New England. The islands sort of off of the coast of Massachusetts. So that's where a lot of the cases were first recognized. And over time, it's kind of come northward. And so we're seeing it in Vermont with increased frequency over the last probably 10 years or so. There's still a south-north tendency. So in the southern part of the state, there's more Lyme disease than we see up here in the northern part of the state. But the sort of prediction is that we're going to see more over time. And certainly this year it's felt that we might see more because we've had some mild winter. We had another mild winter. So Lyme disease is actually not caused by the tick, but it's caused by a bacteria in the Borrelia family. And that bacteria is inside the tick, and when the tick sort of attaches to a human host, it can transmit the bacteria into the human. It's not a bacteria that can be spread from one human to another or from a dog to a human. It's only through the bite of a tick. And I think it's important to know that the tick needs to be attached for at least 36 to 48 hours before it would be transmitted.
Okay.
So we sort of breathe a sigh of relief when we know that the tick has been there less than 36 hours.
Okay.
So anyway, so the disease itself kind of covers 3 different stages. There's what's called the early localized phase, and that phase of it is typically recognized because there's a specific rash in Lyme disease. And the rash is called erythema migrans, or EM. A lot of people describe it as a bullseye rash, but there are pictures that we'll be showing that show one erythema migrans rash that really is just one large red round area. And over time, there can be a clearing around the central red area, and then there's an outside ring so it looks like a bullseye.
Interesting.
And that typically happens, or we see that rash in about 70 to 80% of the early disease. So not every individual that has early disease necessarily has the rash. The other symptoms are also seen, are tricky because they look for all the world like a lot of viral illnesses.
Yeah.
And so with those symptoms, fever, fatigue, headache, kind of achiness, those symptoms are pretty nonspecific. And there's this saying in medicine, when you hear hoofbeats, think horses, not zebras. And for us in pediatrics, the horses would be viruses, and the zebra is Lyme disease.
Got it.
So those symptoms are still much more likely to be associated with viruses that we see in the summer than they are a child actually having Lyme disease. So that's the early phase. The early disseminated phase is when the bacteria actually gets into the bloodstream and it travels to different parts of the body. It can travel to the heart, it can travel to the central nervous system or the brain and the spinal fluid, and it can travel to the joints. And when that happens, and that's usually weeks to months later, as opposed to the early localized is days to weeks. So when that happens, when it affects the joints, you'll see arthritis, swollen, painful joints. When it travels to the heart, it can cause sort of inflammation in the heart, where sometimes there'll be an irritation of the heart that makes the heart rhythm a little bit irregular. And when it goes to the central nervous system, the most common finding is actually Bell's palsy or facial nerve paralysis. And in kids, as opposed to the Bell's palsy that a lot of people have suffered from, that is not caused by Lyme disease, it's not uncommon to have both sides affected, so the face would droop on both sides.
Wow.
And then meningitis, where there's a headache and neck pain, and then encephalitis, which is when the brain is just kind of irritated. And I think that covers kind of the early disseminated. And then the late disseminated is most likely chronic arthritis.
Yeah.
So the good news is, though,
There's good news in this.
all of that being said, there is, when Lyme disease is recognized, it's very treatable, and you typically entirely recover from it.
Really? Okay, that's good. I hear varying degrees of people saying how long it lasts, and I'm like, oh my gosh, it's going to be a
Yeah.
lifetime. But no, it's treatable and curable.
It's treatable, and it's generally entirely curable. There is something that's called chronic Lyme disease, which is what we hear a lot about.
Yeah.
I'm sure we've all had a friend who has been diagnosed, where the symptoms drag on for quite some time. It's not felt to be related to having an active infection anymore. It's felt to be more sort of the post-inflammatory effect.
Interesting.
And it's pretty rare, that aspect of Lyme.
Wow. And you feeling that the trend of Lyme is going up, or tick prevalence is going up? Is the Lyme disease going up too?
Yes, because the ticks that actually carry the bacteria that cause Lyme, there are more ticks that are carrying it because of this migration, this northern migration. Although, again, to put things in perspective, and I should also mention that there's 3 different ticks in Vermont. We do have a photo that shows the 3 different ticks.
Okay.
One of them is the Lone Star, which is pretty uncommon and doesn't transmit Lyme disease. One is the dog tick, which is very common but does not transmit Lyme disease. And then the third is what has historically been called the deer tick, but I think there's a movement toward calling it the black-legged tick because it's on more than just deer. And those are the ticks that carry Lyme. And that particular species of tick is more and more carrying Lyme, but it's still, I always tell parents when they pull a tick off, there's kind of 3 gates that you have to go through to even begin to worry. And the first is that it's been attached for more than 36 to 48 hours. The second is that it's truly a deer tick and not a dog or a Lone Star tick. And the third is that it has to carry the bacteria. And most ticks in Vermont, even the black-legged tick, most of them still do not carry. It's still the minority of ticks that carry the disease.
Wow, so you've given a lot of great information. So our time is getting short, but what do you do to prevent? I mean, is there anything that parents, what's the advice for parents to prevent this from the first place?
Yeah, so one of the things about pediatricians, we are the gurus of preventative disease.
Yes.
We talk a lot about vaccinations to help prevent vaccine illnesses. We talk about anticipatory guidance and how to prevent injury, and I think ticks is a classic example of an ounce of prevention is worth a pound of cure. So some of the things that can be done, number one, when we get into this season, which we are now in, going out into the wood, because we want kids to get out and play and be outdoors.
Right.
But getting out into the wooded and fielded areas with full covering, so long pants, tuck the pants into socks, long sleeve shirts. Try to have them be light, so when you come indoors and if you can actually see if there's a tick on them. There are insect repellents that are very effective. I think over the years people have been worried about using DEET in young children.
Right.
I would not recommend it in less than a 2-month-old, but 2-month-olds aren't likely to be crawling around in the woods. So it is safe if it's 30% or less, and that can be put on bodies to prevent the ticks from getting into the skin. And then permethrin is another insect repellent that can be sprayed on clothing but not on the skin, and those are other preventions. I think that's kind of the mainstay of it.
Great. Well, thank you so much. I'm sure we could go on and on. This is a great topic. You've given us some great information to prepare us for spring and summer, so thank you very much for joining the show.
Thank you.
I'm Jill Bowen, CEO of Northwestern Medical Center and your host of the Health Beat show. This has been quite interesting to learn about ticks. I've learned a lot too, and the tool that I need to keep with me to help if needed. And also make sure when you're outside, we want you to be playing. We want active play. We're gonna have a great spring and summer season, and we wanna make sure that you're safe. So make sure you wear long clothing, your pants and shirts, and to protect, and wear light colors as well. So you can easily see if there is a tick. But don't let that prevent you from getting out and playing. Thank you.